so today I'm going to be giving an intramuscular injection. So the first thing you want to do is you want to check your order to make sure that the medication is ordered. And today our order is 0.4 milliliters of sterile water. So after that you want to check for allergies to make sure that your patient doesn't have any allergies to the medication that you're about to give. And you want to gather your supplies, you want to wash your hands, and you want to make sure that of your 6 rights, so right patient, right drug, right dose, right time, right route, and right documentation. So for IM injections, I'm going to be giving this injection in a 22 gauge needle that's 1.5 inches long, but you can also give 19, 20, 21, or 22 gauge, and it can be 1/2 inch, or 1 inch, 1.5 inches, or 2 inches long. So what you're going to be doing next is you're going to check the MAR 3 times. You're going to check the medication when you take it out of the Pyxis. You're going to check it again when you're drawing it up, and then one more time at the bedside. So to get your medicine ready, you take your vial, and then you take your alcohol swab, and you clean the top well. And then since we're giving 0.4 milliliters, I'm going to draw up 0.4 milliliters of air to uncap my needle. Then I'm going to inject the air into the vial. And I'm going to draw up 0.4 milliliters of sterile water. Okay, since I used a different needle to draw it up, I am going to change out the needle. And then I would label this medication with the drug and the dose while I transport it to the bedside. So when I get to the bedside, I'm going to wash my hands, and I'm going to put on my gloves. I'm going to be telling my patient what I'm going to be doing with them today, so I'm going to be giving them an injection. And then I would ask them to tell me their name and their date of birth or 2 other identifiers. And then I'm going to make sure that they do not have any allergies by asking them and checking their band. And so then you would do a focused assessment if you needed to, like taking vital signs or looking at lab values or anything like that. So the sites of IM injections are the vastus lateralis, which is on the thigh. You take one hand on the upper thigh and one hand on the lower thigh, and then you give it on the side here. The next one is ventrogluteal, so you put one hand on the trochanter and then you make a V with your fingers, and then you can inject it right there. Another one is dorsogluteal, which is on the outer quadrant of the buttocks, and then the next one is deltoid, and that's 2 fingers below the acromion process. So then, to get the patient ready to give the injection, you're going to choose your site, and then you're going to clean the skin for about 30 seconds with alcohol. And before you give this injection, you want to make sure that you have an antidote with you just in case the patient has a bad reaction to the medicine. So what you want to do is you can either pinch the skin or pull it taut to give an IM injection. I'm going to pull the skin taut. So you're going to uncap your needle, and at a dart-like motion at 90 degrees, you are going to give the injection. So with the skin pulled taut, I'm going to give the injection. Push it in slowly. Pull it out, and then let go of the skin. And you may massage the skin if you need to. And also, if the area is bleeding, you can apply a little bit of pressure with a cotton ball or a Band-Aid or something. You dispose of your sharps, and that's it.